South Australia has recorded 2,503 new cases and 1 COVID-linked, the day before significant restrictions are scrapped. Key points. SA records 2,503 new cases and 1 COVID-linked. SA records 2,503 new cases and 1 COVID-linked. The state will significantly ease restrictions tomorrow. The state will significantly ease restrictions tomorrow. Sampling shows 100% of cases are Omicron. SA Health said a man in his 70s. Case numbers have hovered around 2,500 for the past few days, and active cases are now at 22,054. However, the number of people in hospital has continued to decrease and now sits at 88. There are 10 people in intensive care and 2 requiring a ventilator. SA Health said its regular genome sampling of COVID cases showed that 100% were the Omicron variant. SA will further relax COVID rules tomorrow, taking the state to its most relaxed level of restrictions since the pandemic arrived. The changes come as the Omicron subvariant BA.2 raises concerns interstate. The variant has also been detected in South Australia, but Police Commissioner and State Emergency Coordinator Grant Stevens told ABC Radio Adelaide this morning that he had not received any specific advice from SA Health. It hasn't been brought to my attention as a variant of concern or any indication that the arrival of this subvariant is going to change our current situation in terms of how we're managing COVID, he said. I suppose as a contrast, when Omicron first emerged, there was urgent discussions and meetings held about the possible implications of this new variant, and we have not had that at this point in time. So I'd take that as a sign of confidence that people aren't specifically concerned about this new variant at this time, and let's hope it stays that way. South Australian epidemiologist Adrian Esterman said there was reason to be concerned about the Omicron subvariant BA.2. He said while research showed the subvariant had the same rate of hospitalizations and ability to evade the immune systems as BA.1, because it was more transmissible, there would be more cases, and therefore more hospitalizations. According to the latest genome sampling from SA Health, about 1 in 5 cases in South Australia are BA.2. Professor Esterman said the subvariant would become the dominant strain in SA. A couple of weeks ago, it was about 10% of Australian cases. Today it's about 25% of Australian cases. And in a couple of weeks' time it's probably going to be 100% of Australian cases, he said. However, Immunisation Coalition Chair Dr. Rod Pearce told ABC Radio Adelaide's David Bevan he had spoken about the new subvariant with interstate colleagues, and they believed the current vaccines offered enough protection against it. We're still happy with the coverage, and we're still happy our treatments are working, he said. M to mute, left and right arrows to seek, up and down arrows for volume. Watch 15 minutes 2 seconds 15 M. Will winter bring a COVID-19 onslaught?